Okay, my name is Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine. And in today's webinar, we're going to talk about a number of different things concerning regenerative medicine. You'll learn about the best available treatments for arthritis and tendinitis that do not require surgery. That includes using your own blood platelets and your own stem cells. You'll also learn about what is legitimate and not legitimate in the field of regenerative medicine, how to choose the best physicians and clinics for regenerative medicine, and how to avoid what is not as legitimate. So the big question to start is, what would you do if your pain was controlled? How would your life improve? What exercises would you restart? What activities with family and friends would you participate in? So who am I? My name is Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, specialist in rheumatology, specialist in image-guided musculoskeletal injections, in practice since 2008, involved in regenerative medicine since 2008 as well, and in the Regenix network, which is the largest network of physicians involved in regenerative medicine since 2012. So my journey to regenerative medicine really started with my own shoulder. I had a mild shoulder injury from playing tennis as a teenager. I started to learn about diagnostic musculoskeletal ultrasound to look at joints and tendons toward the end of my fellowship and training. I learned about tendon and ligament injuries, not only from like a theoretical standpoint, but really what's happening when you're looking at it under ultrasound. And from that, I started to realize that the treatment options that we were offering patients traditionally were not very good. So traditional care is really insufficient for when you're talking about arthritis, joint pains, tendinitis and tendon tears, sprains and strains, or back and neck pains. They essentially mask the pain and they're waiting for eventual surgery, which is really a terrible approach to care. Other traditional options, pain medications, they don't fix the problem. The side effects include kidney, stomach, liver, heart, and bleeding issues potentially. In addition, traditional injections, including steroid injections, have the potential to damage tissue. The same thing with nerve blocks and radiofrequency ablation. So there should be better options. Surgery, on the other hand, it has higher risk. While there is a role for surgery in some conditions, for routine issues, surgery has higher risk. It can accelerate the arthritis process, can lead to more instability. Many routine surgeries are not proven to be effective. As an example, cutting out your meniscus if you already have knee arthritis. Multiple studies, including a recent one, shows that it's no better than just physical therapy alone. And for those of us involved in regenerative medicine in a very deep way, strong feeling that 80% of musculoskeletal conditions will eventually be able to avoid surgery with regenerative medicine. So in searching for better options, I'm looking for options that are low risk, really minimal side effects, improve the actual cause of the problem, and give you better long-term improvement. So imagine reducing your pain and getting back to the activities you care about without surgery or pain medications. So what is regenerative medicine? It's the process of using your own body cells to treat musculoskeletal conditions. So in the normal healing process, if you imagine, let's say, a small cut to your finger, you have platelets that infiltrate the area, releases growth factors, which then leads to mild inflammation, which then leads to a normal healing process by your cells, including your stem cells. So this works great in tissue that's good blood flow, but in tissues with poor blood flow that do not heal well, that includes tendons, cartilage, ligament, discs, labrum, and meniscuses, you can get chronic issues because they're not healing well from the normal process. So regenerative medicine is the process where we take those same cells and inject those into tissue that's been damaged to help coordinate the normal process of injury recovery. So why regenerative medicine? Number one, it treats the source of the problem. It really is harnessing your normal healing process. It's definitely safer than surgery. These are needle-guided procedures as opposed to open surgeries. Effective for most musculoskeletal conditions. And again, for those of us doing this seriously, we really feel like this should make up 80% of treatments for orthopedic, to replace orthopedic surgery. So how does regenerative medicine work? A number of different ways. For starters, it helps to optimize tissue that's been previously damaged. So it can help take cells that are already damaged and get them to start functioning better. It can, and it does that by getting those cells that have been damaged to start producing the correct kind of proteins and enzymes you see in a healthy joint or tendon. In addition, you can actually add your own healthy stem cells into tissue that's been damaged to then help to replace stem cells that have been more significantly injured. In addition, these treatments work because they help to strengthen your supportive tissues, not only the joint, but the ligaments, the tendons, and other soft tissue structures. Strengthening that ends up leading to a more stronger overall joint, which then leads to better pain and functional improvement long term. In addition, we know these treatments can help reduce chronic inflammation longer term than steroid injections can. And we can also treat nerve and muscular issues that can also drive a lot of pain, which can then also help to reduce pain long term as well. So some basics. Number one, is this legal? Simple answer is yes. More complicated answer is if you are following appropriate guidelines from the FDA. So appropriate guidelines would include, are you using your own cells? So you have to use your own cells, not somebody else's cells. Number two, the cells cannot be significantly altered or adjusted. That means they really have to be processed the same day and cannot be significantly changed from what they normally are. In addition, they need to be injected into orthopedic tissue, not into other types of tissue. If I'm older, common question I get, if I'm older, shouldn't I use someone else's cells? The answer is no. For most orthopedic conditions, there's very good evidence that using your own cells is not only effective, but is safer as well. There's added risk when you're using somebody else's cells. In fact, it's considered illegal in the United States to inject somebody else's living cells into yourself, the exception being for childhood leukemias. And then lastly, is there an age limit? Simple answer is no. Results for knees, lower back, shoulders, ankles, neck, and other peripheral joints, there's no difference based on age. The one difference is in terms of hip outcomes, which can be worse with age. What sort of doctor does these treatments? My strong recommendation is you should work with a physician who's focused on musculoskeletal conditions, not somebody who's treating high blood pressure or age management or other things, but really is focused just on treating joints and tendons. It should be a physician who's focused on non-surgical treatments for orthopedic issues. For orthopedic surgeons who are focused on surgery, they don't have the requisite training for these kind of procedures. And lastly, it should be a proper regenerative medicine expert. And I'll talk about some of those aspects that make somebody a regenerative medicine expert. If your physician does not have an understanding of some of these other issues that I'll talk about, they're probably not an expert in regenerative medicine. So can these treatments help if I've already had surgery? Well, they can help unless you've had, let's say, the joint totally replaced, in which case now you have metal or plastic there, and we can't really do anything about that. My general rules for orthopedic surgery: try to keep your own anatomy, avoid surgeries that cut out tissue, always consider regenerative medicine treatment option prior to proceeding with surgery. So we're going to talk about some very key regenerative medicine concepts. The first is based on stability. It's concept of biotensegrity. So in the field of architecture, there's this concept of tensegrity, which basically means that if you take individual units in a structure on their own, they're weak, but when you put them in close proximity and compression, you get an overall unit that is much stronger. Key, because that's actually what will lead to stability. So, and those are things that we can treat, those additional soft tissue structures. So prolotherapy is the process where we inject your own cells into the soft tissue supportive structures to help strengthen and stabilize the joint, which then gives a better result. The key there is to treat all the layers and depth of treatment. So let's say you have knee arthritis, we treat not only the knee joint, but the ligaments, the tendons, the meniscus, the bone, other soft tissue structures as well, nerves as well. You treat all those layers. And the key here is that there is a progressive strengthening over time. With regenerative medicine and the normal healing process, that improvement takes months. It doesn't take a couple of days, it takes months. And these results lead to longer lasting improvement. This is a case study of a 71-year-old man who's had prior lumbar laminectomy surgery ×2 already. The areas that we treated, because he had chronic lower back pain, like persistent lower back pain despite surgery, we treated the ligaments, the facet joints, muscles, and epidural space. We originally treated him with his own platelets, which gave him some improvement. We then escalated to using his own bone marrow stem cells, which can improve them another 75% as well. Key points here are we treated multiple areas: the ligaments, facet joints, muscles, and epidural space, not just the epidural space, but really the whole functional unit. Next key concept in regenerative medicine is orthobiologic. These are the cells and tissues that are injected into damaged orthopedic tissue. It uses the normal healing process. And again, key to understand, you use your own cells, not somebody else's. Basic issues with orthobiologics: number one, platelets, probably the first line treatment that we'll use for most musculoskeletal issues. The key here with platelets is that they work because they help to recruit other cells and your existing stem cells into the area. It uses focus inflammation, and again, it stimulates your own local stem cells. So it's a good option for mild to moderate conditions, while stem cells we'll end up using for more significantly damaged issues. So the picture on the right side, you'll see two different types of platelet preps. There's platelet-rich plasma that's amber colored, the yellow color. That's what you want. That's taken out the red blood cells. And then there's platelet-rich plasma that has red blood cells. You don't want to use that one. That one causes more inflammation, more pain, and more damage in the joint. The key to understand is that if your physician does not have the ability to change the concentration of your platelet-rich plasma, then they are not giving you a very specific treatment for your specific problem. That's no good, and that's a problem. You want to use a treatment protocol and work with a clinic that is really able to customize your treatment to treat your issue. That's personalized medicine. So this is a case study, a platelet-rich plasma case study of a 45-year-old man referred to me by a sports medicine physician. He's a cyclist. He had knee issues at that time. At the time, we found that he's got patellar tendinitis. And so we ended up treating with platelet-rich plasma. So the picture on the right is an example of what treatment looks like. And so this is his kneecap here. This is the patellar tendon. That's the needle. Under ultrasound guidance, we're injecting a very high concentration of his own platelets into his knee tendon. We ended up giving him 2 treatments, and he was able to get back to full capacity of exercise and work. 3 years later, his other leg was a problem. Now we had hamstring tendinitis. In that case, we treated him with platelet-rich plasma again, and again, he's had a great response and is back to normal activity. Keys to understand there are sometimes multiple treatments can take place, and just how good of a treatment this is when it comes to treating multiple kind of soft tissue injuries, especially when it comes to tendons and ligaments. So the next type of orthobiologic to be aware of are stem cells. These are the main cells that drive tissue repair and recovery after an injury. Again, understand that you want to use your own cells, not somebody else's. Bone marrow-derived stem cells are legal in the US. Fat stem cells are not. There's concern that the FDA has about a certain enzyme that's used in fat stem cell treatment, so stick with your own bone marrow stem cell treatments. You can use fat or adipose for structural support, but that's a bit different than using fat stem cells. If you've heard about amniotic or umbilical cord cells, do not go that way. There's no living cells in these. They can help with soft tissue issues, but I would avoid this. That's not a stem cell treatment. That's really mislabeled or really falsely advertised as something that it's not. You may have heard of IV stem cells. There's no proven benefit for orthopedic conditions. In addition, not actually approved in the United States either. So stem cell treatment outcomes, you can improve pain and function frequently, even in advanced cases. How do we do that? Well, we improve stability, we improve inflammation, and we can get cells that have been chronically damaged to start working healthy and better again. In addition, as your overall stability improves, your function improves, and you're able to do more exercise, just by doing more exercise, because your overall joint is better, you can then get more strength in that area, which can then give more support and then also improve pain as well. Can we improve X-ray and MRI images? For advanced arthritis, no. If you have a tendon tear or ligament tear that's less than 2 centimeters, and I'll show an example of that, yes, we can improve that. If you've got swelling in an arthritic joint, yes, we can improve that. And if you've got some bone changes, we can improve that as well. But really, the main keys here are improving quality of life, function, pain improvement, all the things that actually matter to most people. Can we treat bone-on-bone arthritis? So bone-on-bone arthritis is a really bad term that some physicians use, most physicians use, quite frankly. It's not an accurate term because it doesn't really describe what's going on with the joint. Arthritis is a biologic condition, and thus it's treated with orthobiologic treatments. So if your range of motion and function is still good, then yes, even if you've been labeled as bone-on-bone arthritis, good outcomes are still possible, in particular with knee arthritis and lower back issues. Some caveats: advanced hip osteoarthritis is challenging. And generally, you're better off with hip replacement in that case. But if you have mild to moderate hip osteoarthritis, then regenerative medicine is still definitely a treatment that can be helpful. Some expectations that I'd recommend: number one, focus on pain improvement and functional improvement. In addition, we can improve improving imaging if you have more advanced arthritis is unlikely, but in terms of actually improving pain and function, that is still highly likely. So when it comes to soft tissue injuries, tendons and ligaments, can tendon and ligament tears be treated? Yes. This is a case study of a knee ACL tear. With partial thickness tears, definitely. With some full thickness tears, actually, we can still help with that, as long as the ends of the tendon or ligament are still relatively close together. So this is an example of a 28-year-old man with an ACL tear while playing recreational volleyball. He's actually a butcher. We treated him with his own bone marrow stem cells a couple of months later. And as of 3 months later, he had no pain, and we started dynamic exercise. And I'll show you an MRI of what that looks like. And he's actually continuing to do well. So the picture on the right, this is a picture of the knee. That's the kneecap. That's the thigh bone. That's the shin bone. This is a needle going into the knee. This is an X-ray or fluoroscopy image. And this image, this structure that's lighting up is ACL. The only way that we can tell that we're injecting into this kind of tissue is through X-ray guidance. If your physician is not using X-ray guidance, you cannot inject this sort of tissue. So this is a great picture of what this looks like on MRI in terms of improvement. So on the left is his pre-treatment MRI during his injury. This is his knee ACL right there. That's the bottom portion of it. That's the top portion of it. And in between, it's very hazy and difficult to make out. The radiologist has described this as a full thickness tear. This is 3 months after his treatment. Here now you see an ACL, very clearly outlined, very clearly defined, very linear structure. That's a great outcome. In this gentleman's case, he's had not only improvement in pain and function, he's got a great imaging result as well. That's very exciting. So an example of a rotator cuff tear. This is a 57-year-old man. He's a contractor. Does a lot of overhead activity, presented with shoulder pain. And we've got some ultrasound images of before and after. Images on the left, ultrasound, that right there is a tear, that gap right there is a tear in the tendon. Same thing there as well. This other tissue is normal tissue, but that gap is where the tendon is torn. On the right, here we have similar ultrasound pictures a few months after his treatment. Again, where we used to have the gap, and no more gap. Now it's been filled in again. So 3 months after, he has no pain with activity or sleep, back to working, and his images look great as well. That's absolutely fantastic. And he's several years out and has continued to do well. So the last really key thing to understand when it comes to regenerative medicine is this concept of interventional orthopedics. So the process of using image guidance, meaning X-rays or ultrasound, to treat orthopedic injuries. I have colleagues who will tell me, who are a little bit older, who will tell me that they are doing treatments blindly, just by palpating the skin and inserting the needle in, based on experience. I strongly recommend not doing that. And here's the reason why. So the picture on the left is injecting into the rotator cuff. So this is the rotator cuff. This is a very small tear in the rotator cuff that is less than 1 centimeter. and this is the needle. This is an ultrasound image. So a size of a tear that's less than 1 centimeter, you cannot hit that reliably blindly. You need to do that with ultrasound guidance. Picture on the right, this is another shoulder. This is the needle. This is the humerus, and this is the glenoid, other part of the shoulder joint. How do we know we're in the shoulder joint? We see this little bit of contrast that tells us that we're injecting into the shoulder joint. And we also inject it into the labrum here, and that's what that triangular structure is. You can only do this consistently and accurately with image guidance. If your physician is not using image guidance, you're not getting treated appropriately. As I tell my patients, until I have X-ray vision, I'm going to use the tools that we have in the office, and that includes ultrasound and X-rays. These were images that I showed before. Again, the picture on the left is injecting patellar tendon, and the picture on the right is injecting into the ACL. Only way to reliably treat these is through image guidance. It's a case study of an individual with ankle avascular necrosis. That means that the bone in the ankle joint is actually disintegrated. He's a 41-year-old chef. He stands on his feet for 10, 12 hours on end. He has some early wear and tear arthritis, chronic inflammation, but he's also got avascular necrosis, really dying bone. So he ended up getting stem cell treatment protocol, and here's what this looks like. So his image on the left, this is beforehand. You've got a little bit of fluid in the joint, and that's avascular necrosis, again, where the bone is starting to die off. A few months later, there's no more fluid, and what used to be white colored, consistent with that avascular necrosis, the bone changes, has now resolved. He's doing great, back to working full time, working 12 hours on end, and he's a few years out from treatment and continues to do very well. Regenerative medicine treatments offer safe and effective solutions for your pain. So some other follow-up questions that we hear commonly from patients. Number one, is this too good to be true? Great question. I have colleagues that'll say that these treatments are low risk, they can't hurt, but they're not sure of how well they can work. It's unfortunate because the evidence for this goes back to the mid-1990s. Philip Hernigue, who's an orthopedic surgeon from France, has been doing these treatments for knees and shoulders and hips since the mid-1990s. In the Regenetics Network, we have data since 2005. While this is a rapidly developing field, it is not new. We have data that is very robust and goes back 2 decades plus. I have personal experience since 2008. I think for physicians where this is new, it's just not in their wheelhouse. It's just they're not a specialist in regenerative medicine. That's why it's they're not clear on the evidence. There are definitely right and wrong ways to do this. There's definitely appropriate ways to guide people as well. Your expectations as a patient should be grounded in reality and evidence-based medicine. Your physician should be presenting these things in a reasonable and realistic manner. How long do results last? So we have data from Regenetics that goes up to 10 plus years, and again, data from Philip Hernigue from France that goes up over 20 years. For a chronic condition, expect repeat treatment at some point. However, I always recommend people be conservative in their expectations. And that means after a few years of treatment, you may need a booster treatment. So as an example, if you had a stem cell treatment for the knee and 4 or 5 years later, you're doing well, but there's just a little bit of discomfort, then doing a platelet booster treatment can be very helpful. The best way to maintain results after treatment, improve your biomechanics with strengthening, physical therapy, exercise, stretching, take the appropriate supplements for joint health, and repeat treatment is additive to that initial treatment. Costs. These are not routinely covered by insurance. Some exceptions would be if your company has Regenetics corporate plan as part of their benefits plan, then it is covered. Cost estimates in the US for PRP, it's a little bit outdated. This is closer to about $2,000, and stem cell treatments are closer to $8,500. Keys to determine value are the physician and clinic, regenerative medicine experts. Are you receiving a real stem cell treatment or something that has been mislabeled? And understand these are in-office procedures. You do not need to go to the hospital or a surgery center, and thus you can avoid those very higher costs that you see in those kind of settings. So just a little bit more about our approach of regenerative medicine. We're focused on non-surgical treatments for your arthritis, tendinitis, injuries, and back pain. Evaluate you by looking for inflammation, instability, neuromuscular issues. We correct with low-risk interventions first line all the time. If that's not working, then we'll move over to regenerative medicine treatments, utilizing the highest quality treatments that are specific to your condition, tailored to your condition, and delivering cells using the highest level of image guidance. So how to get evaluated? Well, you can go to the website, chicagoarthritis.com. Alternatively, you can also just click on the link that's been entered in the chat, where you can schedule an appointment with us whenever you'd like to. We are here to assist in any way. And if you have additional questions or concerns or things you'd like to learn about, you can enter your questions in now, or alternatively, you can always email us or call us anytime. And again, we're here to help educate and help treat if required as well. Well, we're getting toward the end of today's webinar. If you have any additional questions, please enter them now, and I'll try to answer them. If there's no other questions, but you have additional questions later on, you can always email us or call us later on, and we will assist in any way possible. So I'll hang on for maybe another minute before ending today's webinar. Yeah, you're welcome. Regarding the update, there's a question about hip arthritis. And for hip arthritis, as I mentioned, if you have advanced hip arthritis, I do still recommend surgery. If you have mild to moderate hip arthritis, we can still very much help that. Great question about trigger finger. Yes, we can help with that. Trigger finger is tendinitis of the finger. That's essentially what it is. And so the way to treat that is you end up injecting cells into the actual tendon sheath to help clear out any scar tissue and to help heal the tendon injury. Frequently, people with trigger finger may also have a little bit of carpal tunnel. They may have a little bit of wear and tear arthritis in the finger as well. We'll end up treating that as well, but that is very much a treatable condition as well. Wonderful. Well, it looks like there's no other questions today. Oh, there we go. Okay, somebody asking about, okay, so somebody writing in from, it looks like Albuquerque. Looks like they're following up with a clinic out in Albuquerque in the Regenerative Network. Great. Asking about, would that physician be able to treat their rheumatoid arthritis? I really could not say. You don't know them that well. But if you've got rheumatoid arthritis, I would definitely recommend seeing a board-certified rheumatologist where they can help guide you. I can tell you, as someone who I see both autoimmune issues like rheumatoid arthritis and also wear and tear arthritis and tendinitis, and try to use really the best options in both cases. The keys in treating wear and tear arthritis, if you also have rheumatoid arthritis, is you want to make sure the overall inflammation is under control first, whether that's through medications, supplements, diet, whatever it is. Get that under control first, and then use your own cells to treat the wear and tear arthritis. You'll get a better result than if you're trying to treat the wear and tear arthritis and the inflammation is still way out of control. Great. Well, looks like we're nearing the end here. You're welcome. It's been a pleasure to talk to everyone here. And until we connect again, hope everyone has a good day and live well. Bye-bye.